I am delighted to be joined this evening by Dr Ute Dibb from the Norton Eye Unit, which is a long-term CBM partner near to Harare, the capital of Zimbabwe, and Godwin Kudzotsa, CBM's country program manager in Zimbabwe. And they are going to talk about their work preventing blindness in Zimbabwe and how this has been affected by the coronavirus pandemic. As we know, COVID has had a devastating impact on health services around the world. Quite aside from the horror of the death toll and the humanitarian impact, it has forced many other vital health services to be put on hold. And as you'll hear today, that has made a major impact on efforts to treat avoidable blindness in Zimbabwe. But you will also hear that there is major cause for hope. Last week, we launched the Light Up Lives campaign. This is a major CBM initiative to help improve access to sight-saving treatment and support in Zimbabwe. Until the 20th of May, the UK government will double all donations from the UK public towards this appeal. And you'll hear more today about how eye treatments can restore sight and light up lives. We hope that you will be inspired to give towards this appeal, which you can do by donating at lightuplives.net/event or by phoning 0800 567 7000. That's 0800 567 7000. And every pound donated will be doubled. Now I'm going to turn to our panelists. I'm going to start with Godwin. So Godwin joins us from the CBM country office in Zimbabwe. Godwin, just tell us about your role and give us a brief description of what your work involves.
Thank you very much. My role basically as a country program manager is to support the coordination for all funding mechanisms and resources that are being set aside towards inclusive eye health to do the tremendous work that we've been doing to save lives and to reduce avoidable blindness in Zimbabwe. So basically my role as a country coordinator is to support all those processes.
Thank you. We wanted to give you this evening some insight into CBM's work in Zimbabwe and the impact of the coronavirus pandemic. However, because of regular issues with internet connection and power in Zimbabwe, we recorded parts of the interview beforehand just to make sure that you would definitely hear all the detail. So here is one we made earlier. Hello, I'm here with Godwin Kudzotsa, Country Program Manager for CBM in Zimbabwe, and he's based in our country office in Harare. Godwin, thank you for joining us.
Thank you very much.
Godwin, could you set the scene for us and tell us a bit about CBM's work in Zimbabwe? How long has CBM been working there, and what are the main types of work that we are doing in the country?
CBM has been working in Zimbabwe for more than 35 years. We have been working in the area of inclusive eye health, where we do programs that help to avoid avoidable blindness, so to speak. We have been working as well on an initiative called CBID, Community-Based Inclusive Development, where we're basically working with and for persons with disabilities in our various programming.
You now have coronavirus very prevalent across Zimbabwe. How has this impacted on the life of Zimbabweans and particularly on people with disabilities? And how has CBM responded?
Yes, the coronavirus has impacted people in Zimbabwe, everyone, and much more so for persons with disabilities. And as a program, we've tried to respond. I would want to highlight some of the critical, elements that I consider very important for us to take note, especially for persons with disabilities. In general, there are very few opportunities, or rather limited opportunities, for persons with disabilities in Zimbabwe in terms of employment, formal employment opportunities. And by itself, that's a huge gap for persons with disabilities. So you would find that most persons with disabilities are in the informal sector, which of course is not very well rewarding in terms of providing the necessary livelihood options. So when you present the COVID-19, into picture, when we contextualize this existing challenge in the purview of COVID-19, I would say there have been major, disruptions in terms of livelihood options for persons with disabilities. You would also notice that even in terms of information about the prevention, the importance of social distancing, the importance of sanitization, the importance of wearing a mask. This is information that has been slow to reach persons with disabilities. And as CBM, we've been alive to this challenge, and we have designed programs to directly intervene in terms of providing messaging specifically for persons with disabilities. You will also see the issue of personal protective equipment has also been a huge challenge for persons with disabilities, and they have had limited access to these important equipment. And we have, as a program, also endeavor to support in terms of providing for PPEs. But of course, we remain constrained in terms of the resources.
Clearly, it's a hugely challenging situation for you at the moment, and we hope and pray that the situation will improve for Zimbabwe very soon. In a moment, we're going to hear from Dr. Ute about the work at the Norton Eye Unit, where they are treating many conditions and preventing blindness. We know that Zimbabwe has a large number of people who are needlessly blind because they cannot access eye health services and basic treatment like cataract surgery. Could you tell us briefly about why avoidable blindness affects so many people in Zimbabwe?
The major problems in Zimbabwe is one, the investment case. There's limited resources that are being set aside for inclusive health in the country. One, two, one of the major reasons why there's high prevalence of avoidable, blindness is because of access issues. There are very few hospitals and health centers that are accessible to persons who need this help. So, it leads to the high numbers of prevalence, or the high numbers of persons with avoidable blindness. We're also looking at issues of transport challenges, where people in Zimbabwe are also, suffering a lot in terms of the economic downturn, and they do not have resources even to seek medical services. And by the way, these medical services are also very expensive in Zimbabwe, and most people cannot afford and cannot access.
Godwin, thank you so much for helping us to understand much better the situation in Zimbabwe. God bless you, and thank you to all, you and all your colleagues, for seeking to overcome the challenges that you are facing and for helping us to launch this hugely exciting Light Up Lives programme.
Thank you very much. Appreciate it.
So there you had just a small insight into some of the challenges for people accessing eye health services in Zimbabwe. Godwin, we've had a question from one of our listeners tonight about whether misinformation about eye health is a problem. Does poor information about the treatment available stop people from seeking treatment? And if so, how are CBM programs in Zimbabwe addressing this?
You will notice some of the programs that we are running at CBM, we are working in hard to reach areas. And within these areas, there are also a lot of misconceptions and myths around issues to do with the basic primary health issues relating to eye care. So with this kind of misinformation, you would find out that quite a number of patients who may get help quickly if they reach out to the clinic, they may go to some of the traditional, persons, some religious, practices that are really not helpful. And these are some of the elements that are critical in terms of driving misconceptions and myth around the primary eye care. As a program, we also endeavor to raise this awareness. Information, correct information around eye health is very powerful, and it's very important for us as a program to also reach out with this kind of information.
Thank you so much. You help us to balance the what seems to be despairing, overwhelming challenges, and yet you're providing really hopeful solutions for us. Thank you. I'm going to take us now over to Dr. Ute Dibb. Dr. Ute, welcome. Could you tell us how you came to be working at Norton Eye Unit?
It's a long story. I'm from Luxembourg. I did all my training in Germany and then joined CBM over 10 years ago. First starting to work in Nepal for some years, then in Rwanda, in Malawi, and along the way met my partner, and then I followed him to Zimbabwe. And once here, I started working for the local partner of CBM, which is Zimbabwe Council for the Blind. So since 2014, I've been working at Norton Eye Unit now.
And we again have done another clip just because we weren't sure whether there was going to be a rainstorm in Zimbabwe or other challenges. So we're going to take you now into an interview with Ute, which shares with us some of the kinds of eye health issues that are prevalent in Zimbabwe and the work that Norton is doing to address them. So Ute, what does your work involve?
Seeing patients in the clinics, doing consultations, as well as then treating them, doing surgeries wherever needed, and doing them aftercare, of course. Our patients come with the very normal problems of needing glasses or having an infection or something like that, but a lot of them will be blind, and then the typical causes for that would be cataracts, which is the clouding of the lens, mostly due to aging, but can also be present in children. Luckily, that's quite rare in children. That condition can be treated in a 10-minute surgery. Another cause for blindness that we very often see is glaucoma. It's a chronic condition with high pressure inside the eyes, and if not treated, that leads to permanent blindness. So these are the normal things. There's quite a bit of cancer as well, because HIV often leads to cancer of the surface of the eye. These are the pictures we typically see.
And could you unpack for us why Zimbabwe has particularly high levels of blindness, including avoidable blindness that could be treated or could have been prevented?
Yeah, the levels of untreated blindness in Zimbabwe are quite high. Global estimates usually say that it's about 1% of any population that is blind, but the surveys that have been done in Zimbabwe show that it's more like 3%. That's really, really high. Most of these cases are preventable. So 75% of all cases of blindness are preventable, and half of them will be due to unoperated cataract. And as I said before, it's a very easy solution to a very big problem in terms of numbers in this country. Now, the reason why we have such a big backlog of unoperated cataracts, there are many, many different reasons. One is that there has been no significant investment in the healthcare system at all in the last couple of years. Most government hospitals have little or no drugs at all, no consumables, often no running water, power cuts. it's a highly dysfunctional system. Then we've got an economic crisis. There was hyperinflation, dollarization, introduction of a funny new currency, dollar gone, dollar back again. Basically, people have lost all their savings twice in the last 15 years. The local currency holds very little value. And at the current state, most people are paid in the local currency. So a civil servant can't even afford to have their parents' cataract operated at a government hospital these days. So there just is no money in the system. Patients are not coming because they can't afford to come. And they have no place to go because the government hospitals are often not functional enough. And also the erosion of the salaries is obviously demoralizing for any workforce. Same for the doctors and nurses. So in the last couple of years, we've had ongoing strikes of doctors and nurses, or both at the same time, which then means there would be even fewer patients operated. It's been quite a difficult situation. Another reason certainly is also the distribution of the eye units, or the distribution of the specialists. Like in most countries, they are concentrated in the urban centers, which is Harare and Bulawayo, and there are very few that sit in the provinces. So for the patients, that means they have to travel long distances to get treatment. That makes it more expensive. And depending on their means, it makes it less likely that they are able to afford it.
And how has that changed the kind of service that Norton has had to provide? That really vast array of challenges that you've just described.
Well, the challenges that we face are obviously linked to it, but slightly different. So Norton is not run by the government, but by a local NGO, Zimbabwe Council for the Blind. And that means the strikes don't affect us, as well as shortages of consumables, or other supplies. That doesn't affect us, luckily. Our water supply is a massive problem, but luckily that's the only really big problem we have at the moment. The overall situation in the country has then driven more and more patients to come and see us because they couldn't get service anywhere else, or they used to be able to afford private doctors, but now with the economic crisis, they can't anymore. So we were getting more and more busy. They do have to pay a fee at our hospital, but it seems to be affordable enough. So the numbers were constantly rising. Otherwise, there's regular service and there's consistent quality. I think this also is something that draws the patients to us. But yeah, the challenges for us is now how to manage those numbers. And as said before, we've got very little space. We had very, very big numbers of patients coming. So by end of 2019, when all the government doctors were on strike since many, many months, and our numbers had gone through the roof, literally, with outpatients and surgeries, we were already somehow at our limit completely in what we could do. And that was 2019. So after that, obviously things changed. But for us, the biggest challenge is how to cope with the pressure.
And yet things did change, and they changed for the worst, didn't they? And we had the advent of COVID. How has the situation in your already extremely overburdened service provision in 2019 been affected by COVID?
Obviously, COVID has affected our work. We were very busy at the beginning of 2020 because the government hospitals were still on strike, or the doctors were still on strike, and then came the first cases and the first deaths, and Zimbabwe very quickly went into a strict lockdown, and literally everything shut down, and all hospitals just went down to treating emergency cases only, and cataracts usually aren't an emergency, so we had no place really to stay open. We did use that time in the lockdown to prepare protocols in order to be able to work safely, having to hunt a bit because what works in the UK is not going to be applicable to Zimbabwe, so we went looking to Cameroon, to India, to China, to other places to find ways of coping with this challenge. Luckily, we had a donor to chip in for protective equipment because obviously we didn't have a budget for that either. And then by June, we started consultations again, and by July, we started doing surgeries again. All the government hospitals were still shut, and the only other really well-functioning eye unit in the country, Morganstair, didn't have an eye surgeon at the time because he was out of the country for further training. So for quite some months, Norton was the only eye unit in the country of 15 million people doing cataract surgeries. And obviously the backlog that we already tried to deal with before had only grown over time because nothing had been done literally in between. So for us, that we had to adopt how we work, which means fewer patients. We see just about 30 or 40 patients in a day. We operate no more than 20 to be able to space everyone out and to keep patients safe, to keep ourselves safe. And with everyone else being shut, it didn't translate it into massive queues at our gate every morning. And I take my hat off to my eye nurse, Sister Mususa, who went out there every morning trying to screen the patients, because obviously we had to now select. There was no way we were going to see everyone. We could not. So we had to select and really only focus on the completely blind patients. Some people would come from very, very far, but it was heartbreaking to continuously tell people, I'm very sorry, you can still see in one eye, come back next year. I'm very sorry, I know you can't see well, but you're still seeing too well to be seen right now, to be operated right now. Please come back next year. Obviously, please come back next year is not really helpful now that we realize that 2021 is just a sequel of 2020. But this is the situation on the ground, or it was until December. Then in December or after Christmas, the numbers started rising quickly here in Zimbabwe, most likely due to the highly infectious South African variant of the virus, so a bit similar to the UK. And then beginning of January, Zimbabwe went into another strict lockdown. So for now, we are shut. We are not quite sure how the lockdown will be eased or not, or when we'll be able to open again. But now we have a very good picture of what we are going to face again, if and when we open again.
Yeah. It's really, really heartbreaking, the situation you describe, and not least because transport to Norton costs people hugely, doesn't it? For them to actually, pay to get to you and then not to be able to treat it it's absolutely heartbreaking. It's clearly hugely worrying, and losing your sight anywhere in the world is an extremely challenging and distressing prospect. Could you give us some sense of the particular issues that people face in Zimbabwe if they lose their sight?
As you say, it's always a challenge to lose your sight, no matter where you are in the world. I think what is specifically difficult in Zimbabwe is the fact that we've got an unemployment rate of 90%. So most people don't have any jobs. And then if you turn blind, competing with many, many others to earn some money somehow, you immediately find yourself at the end of basically every queue in your daily life. And there is no government safety network whatsoever. So the families are the ones then to try and chip in and assist as much and however they can. But it also means that if a person turns blind, that adds burden to the family financially, also logistically. It's not easy. If it's a younger person, education is a challenge. There are some schools for the blind, but they're nowhere near enough. That's a big problem as well. It's this typical cycle of poverty and disability. So these people turn blind because they're poor, because they can't afford the treatment, and then they stay poor because they're blind and they can't earn any money. And to get out of this poverty disability cycle is really, really challenging in a country like Zimbabwe.
As you know, CBM has just launched our new fundraising appeal, Light Up Lives. And this is an appeal in the UK to help improve eye health services and reduce avoidable blindness in Zimbabwe. What are the most important things that you hope this programme will achieve?
What I hope that Light Up Lives will achieve is more eye care services closer to the home of the patient. So we need more eye units staffed and equipped closer to the patients so that they can be treated, that surgeries can be done without the patient having to travel far distances. It will also help if we have more basic eye care training for community nurses who are in the villages, who do the primary services, health services for the patients. The more knowledge there is, the more awareness of eye problems or for eye problems, the better it will be for the patients in the end. And for us specifically in Norton, it would hugely help to somehow reduce the burden of this avoidable blindness. That there's such a high demand for eye care in Zimbabwe. We do need a lot more places where people can get help.
Lastly, what would you say to somebody who is thinking about donating and supporting the work that you do?
Sight restoring cataract surgeries, it's one of the most cost-effective healthcare interventions by all means and by a long way. So it doesn't take long, it's about 10 minutes, doesn't cost very much. And literally in 10 minutes to go from disability to independence, it doesn't get much better than that. I know I'm biased, of course, But I think it's a huge cause to support. And now that the UK government has promised to double any donation that can be made, it's a great time to do so.
Dr Ute Dibb, we are immensely grateful to you for the integral role that you are playing in this life-transforming programme. We know that Light Up Lives is going to change the way that thousands of people living with treatable or avoidable blindness in Zimbabwe, how their lives are affected, their capacity to be independent, and we are hugely grateful for your contribution to that, and thank you so much for joining us today.
Thank you for having me.
Thank you so much, Ute. And just the footage there just gives such a clear picture of what you're dealing with on a daily basis. I'm going to ask Godwin and Ute to join me now. You'll be glad to hear that the questions are coming in thick and fast. So we will have the chance to get through a good deal before the night is out. So first question, which came in advance from Claire, who knows Zimbabwe very well. How do people with sight problems find out about hospitals like Norton, particularly if they live far away? And how do they usually travel there? So that's probably for Ute.
It's a lot of word of mouth. We, for a long time, did a lot of outreach work as well. So we did eye camps all over the province that Norton is located in. So through there, we got the word out. Then we've got a very good network of eye care nurses, ophthalmic nurses across the province as well as across the country. And with WhatsApp groups, then they know when we do an eye camp or when they've got a question, they let us know and they refer patients to us. So it often works along those lines of referral from primary healthcare workers to eye care nurses, and they refer to us, and then a lot of word of mouth. And traveling to us, depending on where the patient comes from, it can be in a wheelbarrow at times. We've seen that in eye camps or on Scotch cards or hour-long on minibuses on really bad roads. So yeah, it's a challenge.
Yeah, indeed. A question for Godwin. A number of people have asked, why is it that the levels of blindness in countries like Zimbabwe are so high? And are the causes of blindness the same as they are in the UK?
Thank you for that question. Obviously, if you look at Zimbabwe and the kind of economic downturn we've had for decades, it speaks a lot in terms of the investment case, the amount of money that government has been able to commit, especially for eye health. And when you also look at individuals, the average person in remote areas, they do not have employment, like Ute already mentioned, 90% of unemployment, and you know, the limited livelihoods options, and you will find quite a number of citizens do not have access to these services because they don't have money. So basically, it comes back to money issues and also issues relating to access, where there are limited resources and services in government institutions to be able to provide, you know, this important service. So at the end of the day, you'll find out that people cannot access you know, basic cataract surgery like Ute has just mentioned.
Yes, and obviously, Ute, you and I had that conversation a little while ago. Since then, the situation has changed. What is the update on when Norton might reopen? And are you anticipating that there will still be reduced services because of COVID?
The lockdown has been extended further, even though the numbers of infections have gone down in Zimbabwe quite significantly over the last couple of weeks. And we did open again from last week and started surgeries as of today. And of course, we do strictly adhere to the COVID protocols that we had worked on and implemented last year already. So the numbers will stay reduced for quite some time, just to make it as safe as possible for us and the patients. So no more than 20 patients a day for surgeries and consultations. Obviously, it will still mean that we'll always have a bit of a backlog, but we need to be safe rather than sorry now to be able to work into the future for a long time. So there was a question I saw about how do we keep ourselves safe, and that was by establishing these protocols. They have over time now become the national protocols for eye care in Zimbabwe. What we've worked on in Norton, we have PPE and we have enough of it. And we constantly update also as a team to make sure that everyone keeps on track and we all adhere to the rules we have given ourselves, basically, to stay safe.
And we've had a question from Jaya. Can you please share your top 3 priorities for donations that reach Norton Eye Unit via CBM?
Nice question. We are very lucky at the moment. We are getting an extension of our outpatients department because it was so crowded before that our patients always had to sit outside on the grass while waiting for their consultations. We had to do our checks for glasses and vision and so on, all outside, a bit of a challenge in the rainy season. So we'll have quite a lot more space very soon. Now, of course, we need some equipment also to make that, to fill the space and to increase our efficiency. And one thing would be a slit lamp. We need a contactless tonometer, an eye care tonometer. Ideally, we would also have a visual field analyzer, so that these are some diagnostic equipments that would really help us to be more efficient.
Well, everything crossed. A question for Godwin from Wayne. How many people do you hope to treat if you receive the level of funding you're targeting via this Light Up Lives appeal?
Very, very interesting question there. I would say on average, without a subsidy, a surgery takes around, on the high note actually, when you access from government, around 200. That's what I checked with the ophthalmologist. But the moment we have a subsidy with funding that will come, especially if we get this kind of support, it will mean a substantial decrease where we can reach quite a big number with cataract surgical support in Midlands. I may not be in a position to give a figure at this point in time, obviously, but quite a huge number that we can reach with services if we get more funding. I don't know whether I've answered or not, but that's how I would look at it. Thank you.
Well, I can supplement there that the absolute minimum that we would hope to reach would be 40,000. But actually, we would love to reach twice that many. And it really depends on how much we manage to raise. So it's completely dependent on the total amount that Light Up Lives brings in, the number of people that we are able to reach. We've got a question from Barbara, who would like to know, do we use mobile clinics to reach the provinces?
We do, in a way that we have eye nurses stationed at every district hospital in Zimbabwe, and they do the clinics there. So Norton, we used to go out quite a lot to do our clinics ourselves. This was before I had kids, then I had 2 young kids, and that's not the ideal time to be out in the field to do eye camps and so on. And afterwards, we found ourselves so overwhelmed in Norton with numbers that for every day or week we went out, we built up more backlog in Norton. So we then decided that we were going to stay put in Norton. We were going to train the eye care nurses even better and quite regularly so that they would be better equipped to be dealing with the patients on the ground. And then there's also a team from the University Hospital in Harare that does some eye camps in the province as well. So we've sort of got more players in the field, so we don't have to do it all by ourselves. Our team is fairly small. We're 2 eye doctors and 3 eye nurses. So quite limited in terms of human resources to be tackling such large numbers.
Sure. Okay, we have a question about the availability of vaccines. So perhaps I'll go to Godwin first and then Ute. How likely is it that medical staff will be able to access a vaccination programme? And once vaccinated, what will be the impact on your work? So Godwin, what's the situation like in Zimbabwe for vaccinations?
Yes, I know we have received a consignment of around 200,000 from the government, and we are quite excited about that. Our only hope is that if it can also reach many more, because I know that the current strategy is to reach out, especially those providing basic primary services, like hospital, and we do hope along the way, the average common person can be in a position to also access vaccine. Yeah.
Yeah, so some weeks ago, we had no idea when, how, and if Zimbabwe was going to access any vaccinations at all, and it did look quite bleak. And then suddenly there was the news that China was donating something last week. Vaccinations arrived in country, and as of yesterday, the government has started to vaccinate healthcare workers. And as a matter of fact, today, all of the Norton Eye Care team got their first jab of the Chinese vaccine. So we are delighted, obviously, to have had the chance to get that. We'll need the second jab in a month or so. It will still take time for this to positively affect our work, because even if we ourselves should now be protected against getting a severe disease, we might still be able to transmit it. Most of our patients are elderly patients, or lots of them, they are at specific risks. And for the general population to get the vaccine might well be another year or so. It depends on how the vaccine distribution is being tackled internationally. So not so much that Zimbabwe can do right now.
No, but as you say, that was quite a surprise for those 200,000 to arrive, but they still are only 200,000 for a population of many millions. Yeah. So it's a great start, but we have a long way to go yet. David has asked about the follow-up support that is needed after cataract surgery. For example, prescribing glasses. So could you just talk about what is required? It's not just the operation itself, is it?
So obviously the patient needs to be seen the next day to make sure surgery went fine, and then we sent them home with medicines. The medicines, they are given for free, or it's included in the surgical fee they pay, to really make sure that they get the right thing and not something that someone else just gives to them. And then after a month, they should have a follow-up to make sure, or to check whether they need any glasses, whether for distance or for reading, whatever is required. We do ask the patient usually to come back to Norton, but depending on where they stay, and now especially with COVID, we make good use of our network of eye care nurses across the country, basically. And we will always know where the patient comes from, who's the nearest eye nurse, wherever the patient lives, and they can then go there for a follow-up. If there's a question, we get a WhatsApp message, and then we deal over WhatsApp with the patient, so the patient doesn't have to travel too far.
Brilliant, thank you. We've got many questions. Unfortunately, we're not going to be able to cover all of them. We've got a couple of people asking, how much do we want to raise and what do we intend to do with the money? So I don't know whether it's possible, maybe Godwin, if you give one or two specifics about what we would actually do with the money.
Yes, one of the critical components that the issue of consumables, the cataract kits, they seem like a small thing, but you find out that in most of our clinics and eye units, we do not have this. So this funding will go toward the purchase of these consumables, which are very critical for people like Dr. Ute to be able to do the important surgeries. We are also going to look into issues of awareness raising in terms of the myth and misconceptions, especially at the local level. I've seen someone has asked in terms of what we're going to be doing to raise awareness about good eye health, practices. So in this program, we're going also to raise awareness around good practices and also debunking myth and misconceptions around, primary eye health care. We are also going to look into the purchase of important, equipments that will allow for Dr. Ute and, ophthalmic nurses and other ophthalmologists to be able to do this important work. So we do believe that this funding is very, very critical in terms of meeting the primary basic provisions for the important cataract surgeries to be able to happen within the clinics. Yeah.
That's great, thank you very much. We've also had a question about whether we are going to roll this program out to all of the provinces. And obviously we don't have that capacity. This program isn't going to be big enough, but as I say, the more we raise, the more people we can reach. So we're coming towards the end of our question time. I have just probably one more for each of the panelists. Ute, do you manage to train any ophthalmologists at Norton, or are you actually the only eye surgeon there at the moment?
We're two eye surgeons there currently. I've got Dr. Chinyambiri, my colleague here from Zimbabwe. She came for training some years ago and then joined us, luckily for me. Ophthalmologists are being trained at the University Hospital in Harare and in Bulawayo, and from time to time someone then comes for an attachment of some time, basically for the surgical training, because this is often an issue if they train at the University Hospital, that there are so many people who want to learn surgery, there are not enough patients, and all the other challenges that we've mentioned before. So we are involved in the training. We're also involved in the training of ophthalmic nurses, because they regularly come for a longer attachment from both training institutions, Bulawayo and Harare. So we do a lot of that. And once they're then deployed in the field, if it's in our province, they come back to Norton at least once a year for some more training. And that's then intensive training. There was a question also on children and eye health. So for instance, there's been a program to train them specifically to recognize cataracts in children or eye cancer in children, which is also a problem in Zimbabwe. So these things are happening, and as much as possible, we are involved in doing some of the training as well.
And Godwin, a question for you about how the economic situation in Zimbabwe affects this program, affects, for example, the power outages that are very common, affects the capacity of people to respond to the services that may become available to them.
I would say there are a myriad of challenges, really, in terms of one, government's ability to provide the service within the hospitals. With limited funding, government is not always capable to purchase the critical consumables. You know, some of the equipment we have in our units are now absolute, you know, and these are critical equipment that should be there to be able to operate. So when you look at in terms of service provision and the limited resources that government has, that's a huge problem. But you also have situations where the average person in a very remote area do not have even access to this limited resource by virtue of not having the little money or the little bus fare to be able to travel and access this resource. So it then becomes very critical for programs like this to also consider issues around outreach programs to reach to the most need who cannot even travel to get this resource. So you can really look at poverty from different angles, and the individual person who cannot access the service, and even in terms of service provision, where issues of quality are becoming an issue because of the unavailability of equipment and important machinery that should be there to carry out these surgeries. So yes, it comes from very different angles, I would say, in terms of the challenges we are facing as a country.
Yeah, thank you. And just to remind everybody that we are seeking to do a range of things in Light Up Lives. You will have heard the immense pressure that places like Norton, specialist centres like Norton face. And one of the main aims of the campaign is to get expertise into the provinces so that people don't all travel to one or two centres where they are then overwhelmed, but that we really want to reduce that pressure and to get expertise out into district level, closer to where people live, so they don't have to travel. We want to upskill staff, and we want to ensure that the eye health services in our catchment area have the resources and the equipment that they need, but always working hand in hand with the government so that we do not create something unsustainable that collapses once we leave. One of the questions that we've received is what it costs for cataract surgery. For adults, it is as inexpensive as £24 per eye. And I am always totally staggered by this figure. As Ute said at the beginning, from disability to independence for £24 per eye. It's more expensive for a child because they need a general anaesthetic, so it's closer to £95. It's a bit of a figure that we have to just estimate because it does differ from place to place. But those are the kind of figures that we're talking about. So when we say 40,000 people as a minimum, we would obviously like that number to be very many more. Ute and Godwin, it has been fantastic to have you with us from the coalface, and I'm so happy that the internet connectivity held up. Can I just ask you to give us a final word before we head into the last few moments of this evening? Perhaps I'll go to Godwin first.
I would just want to thank everyone for being connected and for the support, tremendous support you're giving to the people of Zimbabwe. It's really very much appreciated. Thank you very much.
And Ute?
I'd probably add, I've been working with CBM for over 10 years now, and to tackle this huge problem of avoidable blindness, it needs a lot of things to be right on the ground. It needs infrastructure, equipment, human resources, all of that. And what I've come to appreciate over all this time is that CBM does have the expertise to make things happen on the ground and to bring affordable eye care to as many people as possible, to literally light up lives. And for me, it's always good to know that there is such a strong partner over time to see projects through and not just giving a little bit here or there. So it's been really important because the challenges are many, but we do know that we have support. So thank you for that.
Thank you very much. And thank you to everybody who's joined us this evening and for asking so many fantastic questions that have enabled us to share so much information. And I'm sorry if we didn't get around to answering all the questions that were posted. I'd like to share one story. Each individual person is their own story and they add up to that 40,000 or that 80,000. But this story really brought home for me the human impact of the blindness crisis in Zimbabwe. This is a picture of Ebby, and she was at Norton Eye Unit. This picture was taken in December, and she was one of the last people to receive surgery from Dr. Ute before the hospital closed. Ebby lost her sight 12 years ago to cataracts. She is a widow, and she used to run a business selling hair products. But when her eyesight deteriorated, she had to give up working. And in 2008, she went to a local hospital, but they couldn't do her surgery. The staff weren't even trained to diagnose her properly, let alone having the expertise or the equipment to offer her the treatment that she needed. So for 12 years, she was unnecessarily blind, reliant on her children to survive. And she felt hopeless, helpless. She felt like a burden. Finally, she heard about the services offered at Norton and that she could be operated on there. But she still had a long wait because you saw the crowds massing at the hospital. Thankfully, she was able to receive the treatment that she needed, and she can see again. And now she will have the chance to once again be independent. But that is more than a decade that was lost to her when she was needlessly blind. And this is why the Light Up Lives campaign is so important. Avoidable blindness due to cataracts is such a needless waste when it can be treated for as little as £24. With your help, we can help many more people access sight-saving treatment and support, and every pound will be doubled by the UK government. So please do give if you can. Donate online at lightuplives.net/event or call 0800 567 7000. All donations will help us build a world where nobody is needlessly blind. And I'm just going to end with a moment of prayer and thanksgiving. Father, we give thanks for the gift of sight, for the joy that it brings, and for the capacity to see the beauty of the world around us. We pray for all of those living with sight problems, that they will be able to access the treatment and the support that they need. We pray for an end to stigma and discrimination for people with visual impairment and other types of disability, that we can build a world where all people can enjoy their human rights and fulfill their potential. And we give thanks for those working to end avoidable blindness. In particular, Dr Ute and all of her team at Norton Eye Unit, doing incredible work in such challenging and heartbreaking circumstances. And for Godwin and the CBM team in Zimbabwe, who are managing so many programs like the Light Up Lives appeal that we've heard about this evening. And we give thanks for all that they bring, and we ask you to hold them safely in your hands. We pray for Christian Blind Mission, for all our work, and ask for particular blessings on this Light Up Lives appeal, so that we can transform the lives of people living with sight loss in the world's poorest places. And we finally thank you for the chance to come together and this feeling of unity despite the distance between us all, and ask for blessing upon all those who have joined this evening. Thank you so much for joining with us this evening to celebrate the opportunity that this appeal brings with us. God bless you. Wish you a very good evening and a very optimistic heading into the lightening of the restraints that we've been living with. And we look forward to other ways of interacting with you in the future. Thank you so much to Ute and to Godwin and to all of you for joining us this evening. Good night.